All right, we will get started here. This meeting, as you guys see, is being recorded, so we can make sure are able to place this workshop on OCH's YouTube website. If you have attended a workshop in the past or you're unable to attend it, that is a place where you can find all of our previous workshops if you missed it. So again, welcome to OCHN's SUD August Community Workshop. We're excited to have you here. We are going to have Scott Schadel present for us today from Easterseals on the topic of stigma and substance use disorders. Oh, more people are coming in. In the meantime, right before we get started, just a few housekeeping things. As always, I see many of you did, place your name, your role, and your agency in the chat so we know who we have here with us. You don't have to have your cameras on, but we do encourage it so we can see who's here with us. We can interact a little bit more. We feel a little bit more like we're more in person. Um, if you do have questions, you can use the raise hand feature or use the chat. Kaylee and I will be monitoring the chat and the raise hand feature. That way, it takes one thing off Scott while he's presenting, and we can make sure that we ask those in timely fashions and not interrupting him. What else do I want to make sure we say? Oh, for CEUs, why some of you might be here. Please make sure that you stay the entire time and you complete the evaluation at the end. We will put the evaluation link in the chat at the end of the presentation. We do know sometimes Teams is a great tool and it kicks us off sometimes or the glitches happen. If that does happen, we can see that you jump right back on. That will not interrupt. The CEUs or things of that nature. If you're gone for quite a bit, that might, but if you're trying to hop back on, we understand that that happens sometimes. It happens pretty much every time someone gets kicked off, and just the way Microsoft Teams works. It's always fabulous. At the end, we will provide you guys information with the next upcoming workshops or events for September and October. So with that being said, I think my job here is done to provide all housekeeping items, and I'm going to turn it over to Scott. So Scott, please, welcome.
Thank you, Anna. Good evening, everybody. I'm going to share my screen here and we will get started. All right. So, my name is Scott Schadel. I am the Program Manager of Adult Therapy Services at Easterseals MORC. So I oversee our Pontiac and Southfields Adult Therapy Services locations. I've been in the field for about 30 years now, mostly in substance use, but mental health as well. So, wide variety of experience from working with teenagers and in substance use to uh, mental health services to detox and residential services, and been with Easterseals now for almost 3 years. Um, so happy to be here. Happy to do this training and appreciate everybody joining. So we are talking today about substance use disorder and stigma and the impact that stigma has on those that use or misuse substances. And so wanted to start out. There we go. Wanted to start out by one of the main reasons why stigma is so important to talk about, especially regarding substance use disorders, is that we all stigmatize. Not only do people stigmatize individuals outside of themselves, but they stigmatize themselves as well. And one of the impacts of that stigma is that it really stops people from getting help. And so I was just online and I saw this. Over 46 million Americans aged 12 and older had a substance use disorder in 2021, 16.5% of the population, only 6% of whom received treatment. So, there's a lot of people that, struggle with substances, and unfortunately, not a lot of them ask for help. And part of the reason for that is, how they stigmatize themselves and how society stigmatizes them for having a substance use disorder or misusing substances. So it's an extremely important topic that we need to continue to talk about. So I wanted to first talk about, what is substance use disorder and kind of highlight a few things as to, why it is that individuals who struggle with substances stigmatize themselves and hesitate getting help. So this is one. There's a lot of definitions out there. You can look up, definition of substance use disorders and see a lot of different ones. So I just chose this one from the American Addiction Centers, and it says a substance use disorder is a medical condition that is defined by the inability to control the use of a particular substance or substances despite harmful consequences. In other words, SUDs occur when an individual compulsively misuses drugs or alcohol and continues abusing the substance despite knowing the negative impact it has on their life. And as you can see, I've highlighted and read a few phrases in that definition because I wanted to talk a little bit more about that. And again, about how it impacts people's willingness to get help. So first, inability to control. So, a lot of times one of the biggest misconceptions over the years that I've seen when working with substance use disorder is that people feel that that it's people they have control over the substance use, and um, and it's really it's difficult, just like all of us. It's difficult to accept that we don't have control. So when we're asking somebody who has a substance use disorder or struggles with substances, when we ask them to, make changes or do something different, one of the things that they have to do is admit that they don't have control over their use of substances, which is very difficult for all of us to do. Someone who struggles with food or diet or what have you, struggles with the same thing. It's not easy to say, well, I can't control my eating patterns. I can't control myself when I get in this situation or when I'm around this kind of food or anything. And it's the same thing for people that struggle with substances, is that it's a hard thing to say, I can't control that anymore. I can't control my use. Because again, now you're talking about powerlessness, and that's a very difficult thing to do. So, one of the reasons is that, people hesitate to get help is that it's hard to admit that they don't have control over their use of substances anymore. The second one is completely misuses drugs or alcohol. And it's similar to inability to control. But this when you look at that phrase, completely misuses drugs or alcohol, it really indicates that they hardly ever or ever use substances successfully. And I've heard a lot of people over the years talk to me about how, well, I have control over it. I use substances fine. It's just every once in a while, I something happens. Every once in a while, I use too much or drink too much or what have you. I got that drinking and driving for ABCD reason, or I overdosed. Well, I overdosed because what have you. So it's hard to really indicate and for them to accept that they all they don't have the ability to use successfully because they they want to use, they want to continue to use. And so if they're able to get to that point and admit that, obviously that means change needs to occur. And so that's really difficult for people to accept as well, is that they don't have control, they don't have the ability to use successfully. And the third part, the negative impact it has on their life. And a lot of times you can talk to people and they'll say, well, yeah, I got, so many DUIs, or my family doesn't talk to me, or I lost this relationship or lost this job or what have you. But it's one thing to admit that. It's another thing to state that those consequences are the result of their misuse of drugs or alcohol. And so that's a lot harder for people to admit, because again, if you admit that my inability to control my use, my inability to use successfully causes a negative impact on my life, then now again, you need to do something about that. So it's really difficult for people to admit that there's a problem and to ask for help. And then not only that, but then there's personal responsibility. And so who among us likes to take responsibility for their actions all the time? Who among us likes to say, yep, it's my fault. I did it. I'm responsible for that. It's a lot easier to point the finger at other people. It's a lot easier to, blame the police officer who was out to get me when he pulled me over. My boss didn't like me, so that's why I got fired. Whatever the case may be, and so instead of looking at my own behaviors, my own, what I did, and that my where I'm at today is a result of my behaviors. And so that's really hard for everybody to accept. Because again, once we accept that we're responsible, we have to start making some changes. So it's really kind of, it takes a while to really tear down those walls and really look at why it is that you know, that why do I need to get help, or that it's hard for me to get help. And so, so those are some of the reasons why, we look at people that, hesitate to get help, and, the difficulties that they have for that. So I wanted to start out showing this video, and it really does a nice job of kind of, going over stigma. Let's see if we can get it going. Okay, it worked all these other times. Hold on one second. And of course, it's not going to work. Let me stop sharing for a second. Maybe that'll help. There we go. Just going to move that over here. And then I'll start sharing again. And then we'll go back to the slideshow afterwards. And for some reason, it always starts at the very end. So I remembered this time, didn't remember a lot of times, to start it over. You can all hear that?
Growing up, I didn't feel safe at home, and I was picked on a lot at school. When I was 14, I tried alcohol for the first time. I loved how it made me feel. This is how I've always wanted to feel, like everyone else. I thought I was managing my life with my drinking. However, I became more isolated. Over time, I found myself lying to loved ones, hiding alcohol, and keeping secrets, all so that I could drink without judgment. I never wanted to get to the place where people would say,
"She's ruining her life.
Look at that drunk.
Why would she choose alcohol over her family? I don't get it."
Why is she drinking herself to death? Pfft, worthless.
I started to feel that I was doing this to myself, and alcohol was more important. How did I get here? Did I really choose addiction? I chose to take a drink like most of my friends, but I didn't choose to have an addiction. I realized that living well for myself was the key, which inspired me to learn more about what made me different from my peers. Why I became addicted to alcohol, but they didn't. The part of our brain that keeps us well can have devastating effects if it doesn't work properly. The area of the brain directly behind your forehead is known as the prefrontal cortex. This area is kind of like the brain's executive control. One of its major roles is regulating different pathways in the brain, such as the fear and reward pathways. For example, when we experience traumatic events, the prefrontal cortex activates the fear pathway and signals to another brain structure called the amygdala, which processes fear. In turn, the amygdala may activate another brain area known as the hippocampus, which stores information about threatening people, places, or things. In the future, when we encounter them, the hippocampus will remind us to avoid them. On the other hand, it seems that the reward pathway is less active after trauma. It's possible that substances such as alcohol or heroin are used in an effort to feel better. So what does this mean? Why did my brain think that alcohol was a good coping strategy? Scientists now believe that while the reward pathway is underactive following trauma, the fear pathway is overactive. Remember the prefrontal cortex? Well, it can't do its job properly to balance the two pathways. So, my brain presented the solution to keep drinking, which increases reward and decreases the fear I lived with. At this point, it wasn't about being happy, it was about surviving. Learning that there were real changes in my brain allowed me to be kinder to myself and realize that addiction was not my choice. That being said, I don't want to go back to who I was when I started drinking. When I thought I was the problem, there wasn't much to be done. When I realized something was wrong with my mind, then I knew change was possible. I learned that if I could change my mind, I could change my life and form a new path for myself. Even though we talked about how trauma can lead to addiction, There are many other factors that can also contribute to someone developing an addiction, such as genetics, personality, and mental illness. There is so much value in learning about addiction, and I believe it is the key to reducing stigma. Stigma around addiction is very real, and it is the biggest barrier for people trying to seek treatment. Join the movement with thousands of others working to reduce stigma around substance use and addiction. Visit capsa.ca.
Always good to turn the mic back on. So, I thought it was a good, good representation or example of stigma in that video, and talks about a lot of reasons why people become have issues with substances and misuse substances, and the impact that stigma has. Um, so when we look at stigma, there's a lot of negative associations with that. When we stigmatize others, we look at them in a negative way. So, when some of these words are associated with stigma: shamed, humiliation, shame, embarrassment, discrimination, prejudice, humiliated, scorned, disgrace, bad reputation. A lot of those, when we start stigmatizing others, these are the kind of things and these are the kind of the messages that we give to other people. And people also stigmatize themselves. And so these are the feelings that they have about themselves as they're going through this process, as they're continuing to misuse substances. They're really, struggling with this as well. So why do we stigmatize those who misuse substances? I found this online, and it says a large body of research indicates that stigma is persistent, pervasive, and rooted in the belief that addiction is a personal choice, reflecting a lack of willpower and a moral failing. So again, I highlighted a few areas in red and wanted to talk a little bit more about that, and really the misconceptions of personal choice, lack of willpower, and moral failing. So let's talk about personal choice first. So a lot of times, people believe that using substances is just they've made the choice. That's all they care about. They're selfish. They just want to use. And what they don't understand is that it really becomes a lack of choice. And there's a variety of reasons for that. But people who are continuing to misuse substances really see that there's not another way around this, and not another, there's not another way to, to do this, so to speak. And there's a lot of different reasons for that. One of it is, the impact on the brain, and the video talked a little bit about that. But I found this as well. Drug use impacts the impulse control part of the brain. Thus, drug use causes changes in the brain that can result in a lack of self-control and poor decision making and judgment. And I just thought it was there's a lot of research out there about the impact of the brain, substances impact on the brain, and substance use being a brain disease, and it's all very good. And we could spend the whole time, this whole time, talking about that. But I thought this was good, just a good, example or represent, of how substances impact the brain. The fact that it impacts their lack of self-control. So as they continue to use substances, they lose that ability to control. They lose that ability to make good decisions and make good judgments and healthy decisions for themselves. And so it's a lot of times it's again, they don't really see that there's another choice. And then also when they don't use, when they stop using, how do they feel? And so they get negative. They feel in negative ways when they stop using, or how do I feel happy? How do I feel calm? How do we get an absence of pain without the substances? And we're going to talk a little bit more about that. But, it really is, a situation where, yes, they have to go buy the alcohol, or they have to, however they get the alcohol, however they get the substance, they've got to do what they need to do to take it, do all that. That's all conscious. Those conscious decisions they're making. But they really don't see that there's another choice. that they have a lack of choice. Because if I don't do this, how am I gonna, how am I gonna feel happy? How am I gonna feel calm? How am I gonna escape, from the pain that I feel, both physical, emotional, mental, spiritual, all that. I got another video, and I'm just going to assume we're not going to be able to get to it. I guess I can try, but nope. So I'm going to stop sharing again. Come on. Oh, wait a second to come up this time. Right. There we go. And this video is going to talk about more about the disease model and how more about the impact of substances. And so let me share my screen again, and we'll watch this video real quick.
Addiction 911, disease model of addiction. After watching this video, you will be able to explain how addiction fits into a disease model, compare dopamine released as a result of drugs to sex or food, and describe how the brain changes in a person dependent on drugs. When you hear the word addiction, what comes to mind? Most people, when they hear the word addiction, think about the worst aspects of the problem, the behaviors that are easily seen by others. What we don't see, and what people don't often think about, is that addiction is a disease that is extremely stigmatized. Many people think that if someone wanted, they could just stop using. In reality, especially for substances that cause physical dependence, such as opioids, benzodiazepines, and alcohol, changing use patterns is extremely challenging because of what's going on inside the person. Deep inside our brain lives our pleasure center. Lots of things can activate our pleasure center: food, exercise, sex, and substances, to name a few. Let's take food, for example. When we eat a food we like, chemicals from the food travel to the pleasure center part of our brain and attach to brain receptors, which creates dopamine, the feel-good chemical. Now, if we think of our pleasure center as a feel-good tank, when we eat food, our feel-good tank increases a little. Substances, like food, also cause the creation of dopamine. Unlike with food, though, substances cause the feel-good tank to overflow. Over time, because of substances, those normal, everyday pleasure center activators are less effective at increasing our feel-good tank, and over time, they result in barely any pleasure at all. With more time, these substances become the only way that a person can activate the pleasure center, although the level of activation decreases over time. Eventually, extended use leads to even substances not activating the pleasure center. Instead, the substance becomes necessary to keep the person from feeling really, really bad. The brain becomes dependent on the substance, which is why substance use disorders are considered a disease. You're probably still wondering about those bad things we see with addiction: crime, irresponsibility, lack of respect for others. How does that fit into the disease model of addiction? Because our brain is trying desperately to not feel bad, it develops tunnel vision on obtaining a substance no matter what. It's a compulsion. It has to be obtained. Feeling bad must be avoided. The brain loses sight of things like values, responsibilities, and laws. Its sole focus is to not feel bad. Does this mean that people with addiction should be free to do whatever they have to feel better? No. What this means is that we can't shame someone into ceasing their use, because what may have started with a first-time choice turns into an all-encompassing disease and dependence.
All righty, we'll go back to sharing the screen. So I thought the video did a good job of kind of explaining the disease model, explaining impact on the brain, explaining stigma, and kind of relating all that together in a good kind of introduction to what we're going to talk about. So, in the disease model, it really explains that it's not just, a lack of choice. It's not just that people don't care, people are selfish, what have you. There's a reason why that they act and react and do the things that they do. And the video did a good job talking about the pleasure centers of the brain, the impact that it has on that. And we all do things that we find pleasurable. So like the first time that you ate your favorite food, the first time you did your favorite hobby or your favorite social event or what have you, heard your favorite group or band or artist or what have you, you'd experience pleasure. And when we experience pleasure, we want to do that again. We want, it's just what we're, naturally attracted to. So I've experienced pleasure. I want to do it again so I can experience more pleasure. That's why we do, why we do things and repeat things. And it's no different than folks that are using substances. However, the problem becomes is that, like the video said, when they use substances, first of all, when the substances hit those pleasure centers, it's a lot more intense than, eating chocolate cake, for example. So, they get a really intense, reaction from that. And then, they want to continue to do that. And especially if they're not able to get, those pleasurable feelings, even though maybe not as intense, but they're not able to get those pleasurable feelings for what variety of reasons. Before they used a substance, now they're getting it, so they want to continue. The other problem, however, is that when those substances hit those receptors start getting, duller, so to speak. They start dulling those receptors out. So not only do the substance not give them the same, impact it did before, but it also impacts other activities or other things that they found pleasurable that maybe they don't feel as pleasurable anymore. Maybe that chocolate cake doesn't feel as pleasurable as it did before, or that activity or that concert or what have you. It dulls those pleasure centers. So then now they're feeling less and less pleasure without the substance. So it's really, it's just a good example of how it's more than just, wanting to use or wanting, being selfish or what have you. The other aspect is physical withdrawal. In certain substances, alcohol, opiates, benzodiazepines, are all have a physical addiction to them. Their body becomes dependent physically on those substances. And when they stop using, obviously they experience withdrawal. And for a number of years, I oversaw a withdrawal management and residential program. And the most difficult population we had to keep them without leaving against medical advice, especially within the first 24 hours, were folks who had, who had issues with opiates. Those, because even though opiate withdrawal is not necessarily life-threatening, it certainly is very uncomfortable and very painful. So when they go through withdrawal symptoms, cramping, headaches, nausea, diarrhea, whatever else the case may be, they're extremely uncomfortable. And so even though we would give them certain medications to try to help with that, it doesn't always take them all away. And so the other part of it is that they know, people know, just like any of us, when we feel bad, we want to feel better. Okay. So when I have a headache, for example, what do? I go get Tylenol, I go get ibuprofen, I take it, and hopefully it goes away. It's no different, it's same kind of impulse for folks who are misusing substances, and the fact that when I don't feel well, I know I can go here, I can use this, and I can feel better right away. And that is the attraction to all that, is that it's very difficult. None of us like to feel pain. None of us like to be uncomfortable. And if I know I can do something to take that, to make you feel comfortable or take that pain away, then I have a lot of impulses to do that. So again, it's just another example of the impact that it has. Tolerance, we all, I think most of us know about tolerance, so I don't need to go into too much detail on that. But just that, it takes more substance or more of one substance to get the same, result as before. And so, where when they first started, using opiates, for example, They got a lot of impact from that. They got a pretty intense feeling, and then they continue to use the same opiate over and over again. They're not getting that same feeling, that same pleasure. So maybe they go from where they started with they had surgery and they got prescribed an opiate for pain and they started using that and using that, and then they moved on to they couldn't get that anymore. The script ran out, got too expensive, whatever. They move on to heroin. They start using heroin. They start getting more and more impact with that. And then that's why people, excuse me, go to fentanyl maybe, because they just continue to have to use more and more of a substance or more of a intense substance to get those feelings and everything else. And then it becomes a vicious cycle too, because as they use more and more of it, obviously they get into a vicious cycle to where the use goes from feeling really good when I first use, to maybe now I'm using it just to feel normal, because when I come off the substance again, the physical withdrawal happens, the emotional issues happen, the mental issues happen, what have you, and so we go back into it. And so pretty soon that where it used to get us, really, really pleasurable, now we're just using maybe to feel normal. And the last one is shame. And we talked a little bit about shame, but you know, um, stigma creates shame in others, but individuals that misuse substances already have enough shame. They already, it's not like they don't have, you know, values, beliefs. They don't, they didn't have goals and dreams and aspirations at one point. They're very aware that, that that they're not meeting their potential in a lot of ways. And so there's a lot of shame that goes along with it. At that withdrawal management residential program, we had a lot of people come back. They go through the program, they complete the program, they leave. Maybe they even go to one of our outpatient levels of care. And then 2 months later, they come back. And I'd walk in the lobby and I'd see them and I'd be like, "Hey, how you doing? Good to see you." And they'd be like, "I'm back again." And you could just see the shame and the hopelessness that they had and how bad they felt about themselves. And they certainly didn't need me coming in going, "Why the heck are you back? What happened? You were doing, because they're kicking themselves in the butt enough. They don't need me to do it." And we did a really good job of seeing them and really going, "Well, I'm so happy to see you. You made a good choice for yourself today by coming in. Glad you're safe, glad you're here," and trying to help them alleviate some of that shame, or at least not feel as bad as they did. But there's a lot of shame that they all experience, and within themselves. And not only is the shame because of you know using and where they put themselves, but there's a lot of shame. There's a lot of shame that goes into what they did to get the substance. What shame of what they did while they were on the substance, shame of how they acted when they didn't have the substance, and again, it becomes this big cycle of just everything, every move they make is shameful, and shame turns into hopelessness and worthlessness. And when we feel hopeless and worthless, how motivated are we to make a lot of changes in our life? How motivated are we to make healthy changes? And so so that's a lot of part of the disease model, but it's also just a lot of the reasoning why people struggle, and why it's more than what we sometimes want to think about. So the second part of that definition or explanation of stigma was lack of willpower. And so these are just some of the words that I kind of associated with when I hear lack of willpower. When I think of people, when people talk about people who use or misuse substances and why they don't make changes, why they don't do something different. Just some of the words that I kind of came up with off the top of my head. Weak, they're lazy, selfish, uncaring, coward, manipulative, they're unwilling to change. Some of the words that go along with that. So I'm just curious, what other words do you all think? And you can unmute yourselves, or maybe just put it in the chat if you feel more comfortable doing that. What are some other words that you kind of associate when you hear lack of willpower? What are some when someone says they have a lack of willpower? What do you some other words? What else do you think that they mean?
Unfocused, unmotivated. Those are the two that
Yep.
come to my mind.
Unfocused, unmotivated. What was the third one?
I didn't have one, but I can throw one out.
Oh, I thought you said three. Sorry.
Lack of prioritization.
Yep. Very good. Anybody else?
Like maybe loser or
Yep.
The dirty people or the
Yep. Dirty's a good one. Not a good one, but
Broken.
good example.
yeah.
I'm sorry?
Broken.
Broken?
Yeah,
Okay.
you the person is broken, you can't measure up to the normal people.
Yep. And even abnormal or not normal. That's good too.
I think unloving, because I know a lot of families, right, feel like their family member who's, has an addiction doesn't love them enough to change.
Yep. That's a good point. Yep. That's a great one.
In the chat, we also have lacks discipline. They can work on that. Unhappy with their life, weak, addict, useless, and junkie.
Wonderful. And some of those we're going to talk about in a little bit, but those are all great examples, and it's just, when we talk about lack of willpower, it isn't that any of those are really true, it isn't that they don't want to change. A lot of the folks that I've worked with, they want to change. All those folks, when they came into treatment, most of the time, they wanted to change. They were there because they wanted something different. They were ready to take that first step, and then things happened that didn't allow them to do that. And a lot of that can be just belief in themselves that they can change. If that shame is coming up, that hopelessness and worthlessness is coming up, it makes it really hard to really have faith and belief in yourself that you can change, and faith that things are going to get better. Maybe sometimes it can be past experiences for a variety of things, not just substances. Maybe they tried to do better at a job or get a relationship with their family and it didn't work out. And so they've continually, experienced failure or just things not getting better overall. So there's a lack of faith that if I do this, things will get better. And then, obviously, when you take away the substances, as we talked about, you have the physical withdrawal, but you also have, so physical pain, but you also have mental pain, emotional pain, spiritual pain. A lot of, when they start, not using those substances, all those things keep coming up. And how do I deal with that? How do I deal with those emotions? How do I deal with those fears, that anxiety, the depression, reality of where I'm at today, that the shame and the hopelessness and worthlessness? How do I deal with those things? And they just don't see a way out, or that they have the ability to stop using. So I was, as I was, doing research and stuff for this, I came across all these motivational sayings. And while they're all very good and they can be motivating, I started to think of it from a viewpoint of somebody that is being told you don't have, you lack willpower. So if you're telling me I lack willpower, I started coming in from that view, and I started reading some of this, and I thought, what is their kind of thought process when they hear this? So like one, this is, it's not that some people have it's not that some people have willpower and some don't. It's that some people are ready to change and others are not. So if I'm being told I have a lack of willpower, then what you're really saying is I'm not ready to change, or I don't want to change. And and that's not necessarily the case, because they do want to change and they have the desire to change, but maybe they don't have the ability to change right now. The middle one, to assert your willpower, is simply to make up your mind that you want something and then refuse to put it off or be put off. So it's simple. It's simple just to, say I'm going to do it, and then I do it, and nothing's going to stop me, by golly. And so if I have that attitude, then hey, I got it made. I got it figured out. Without willpower, no gains will be made. Well, if I lack willpower, if you tell me I'm lacking willpower, I guess it's hopeless. I can't do it. Willpower is the key to success. Successful people strive, no matter what they feel, by applying their will to overcome apathy, doubt, or fear. So again, if I lack willpower, I can't be a success. And if I can't be a success, then I don't have the ability to overcome the apathy, doubt, or fear. So it's interesting as again, these are all great sayings, and these are all, I could see me looking at that and saying, boy, that is going to motivate me. I'm not coming from a framework, though, that where I'm being told I don't have a lack or I lack willpower, or I don't have the ability to change. So I just thought that was interesting. And of course, one of the more famous willpower ones, good old Darth here, I find your lack of willpower disturbing. I just thought I'd throw that in there. So before we move on, any questions or anything that we have in the chat or that anybody has? Or any statements, comments, or anything?
There's a couple of comments about the video being really good, but no questions.
All right. Excellent. I'm glad people like it. So why do we have a quote unquote lack of willpower? Why do people have a quote unquote lack of willpower? And there's a variety of reasons why somebody might struggle with willpower, struggle with or just struggle with making those changes. Trauma is a big one. Trauma can be a lot of different things. When you think of trauma, we probably think of physical abuse, sexual abuse, domestic violence, but it can be a lot. It can be loss of a loved one. It could be, a disaster, community disaster. It can be a lot of different things. When we experience traumatic events, number one, and I think one of the videos did talk about it. It impacts our brain. Our brain changes when we go through a traumatic event. So a lot of you, there's a big correlation between substance use disorders and trauma. And so a lot of the folks that we work with have experienced some traumatic event at some point. And many of them, unfortunately, have experienced multiple traumatic events. So we go through a traumatic event to kind of keep it in simple terms. Again, trauma is another one. We could do a whole, training on trauma and spend all our time here on trauma, which we're not going to do today. But, part of the trauma, when you go through trauma, you learn that maybe you're helpless or you can't take care of yourself. You learn that you lack trust and safety with others, or you can't be safe. There is nowhere to be safe. You can't trust anybody else because anybody, if you trust somebody, they're just going to betray you in some way. So trauma has a real impact on people's ability to be able to continue to make the changes that they make and take those courageous steps forward in not using or looking at their own use of substances. Shame, we've talked a lot about shame and feeling hopeless and worthless. But if you struggle with that, if you struggle with feeling hopeless and worthless, if you feel that there is no hope for you, you are not worthwhile, you're not able to make change, what have you, how do you start that process? How do you have faith that you can make those changes? And shame again is a very common thing for folks struggling with substances for them to experience, for a variety of reasons, the past experiences they've had, what other people have told them, how again maybe they've been betrayed or what have you. So it's a real impact on them. Stigma, obviously we're talking about stigma today. But again, not only stigma from others, the stigma from society and people that don't really understand why people use substances, but stigma within themselves. And so, again, if we go back to this slide, if people, again, these are all the words that kind of go along with stigma. When we're stigmatizing others, we're humiliating them, we're shaming them, we're disgracing them, or they're being disgraced, they're being embarrassed. Being discriminated against, they're being isolated and feeling alone or lonely, disgraceful. So stigma has that major of an impact, which is why we're talking about it today. But it's good just to kind of continue to look at that and understand that and the impact that stigma has on folks. Lack of support is another one. Again, we go back to trauma. We talked about, if they experience a traumatic event, then, it's really hard to trust other people. So if we have a lack of ability to trust others, how are we going to feel connected to other people? Also folks have harmed other people through their own behaviors. They've lied, they've manipulated, they've hurt people, they've, done things that they're not proud of. And so how can other people trust them? So that's a big part of this whole process as well, is just trying, who supports me right now? The family and friends might have just kind of pushed them away and said, I can't do this anymore. Or maybe they've gone into treatment before. Maybe they've tried to be sober before, or what have you, and people don't trust that they're going to continue that follow that because they didn't do it before. So there's a lot of isolation and lack of support out there. And then a lot of times, the only supports that these folks a lot of times have is folks that encourage their substance use, encourage them to do the unhealthy behaviors, encouraging them to continue those behaviors for whatever reason. They're getting a benefit out of it, so they want those people to continue doing those things. In treatment, a lot of times you see people that, again, they're in a residential facility, they're safe, they do well, they participate in groups, and they help other people out, and they just you watch them and you'd be like, man, this person's really doing well, and then they would leave, and again they might they go back out in society at some point. And the one thing we really try to work on is that outside support network, because it's so imperative. Because when they go back out there, they're thriving in residential because they have a support network. They have the staff, they have their therapists, they have their medical staff, but they also have each other. They have people that are supporting them and working through that process together. Then they go out there in society and back to their home environment, back to their work environment, or whatever the case may be, and that support's gone. And so they really have to work on that to really build that support network. And if they don't have that support network, where do I go? Who do I talk to? What do I do? And so we'd see that happen a lot of times, unfortunately, as well, as they do really well in residential treatment. They get out in society, and soon after they'd relapse because they just don't have that, that support. We all need support. Think about when you struggle with something. What do? You reach out to somebody. You reach out to a family member or a friend or what have you. When you're not doing well, it helps just to be around other people and be around people that care about you. If you don't have that, what do you do? And then urges and cravings is another one. And urges and cravings, people struggle with this a long time, even though they've been in recovery for a while, or they 30 days, 30 days, 60 days, what have you. Those urges and cravings continue, and they might continue well after that, because they might experience some event or a trigger, and how they dealt with that before is they use substances. So I experienced that same situation, and I have the urge and the craving to use, and so that's something that they continually have to deal with as well. And it's not always easy to just push those aside. It's difficult to battle those urges. We all have urges and cravings, do things that are not the healthiest things for us. How many of us 100% of the time never give into those urges and cravings? I could say probably none of us. Okay. And unfortunately, for folks who misuse substances, relapse is a more extreme example. But again, it's hard to deal with those on a constant basis, on a regular basis. And so urges and cravings play part of that as well. And then the third part was moral failing. And
Real
I found
quick,
this
Scott,
picture.
sorry to interrupt.
Nope.
Someone there's two comments in the chat kind of related to that. So just wanted to know if there's any comments from you for that. One person put low self-esteem, and someone else put genetics ? In regards to lack of willpower.
In regards to how those play a role. Oop, you went muted.
I clicked it. Sorry, unmute.
Mine was about if genetics play a role in, someone's ability to have willpower or be predisposed to, tapping into that willpower or not. Genetics.
Genetics in regards to willpower? I mean, yep. It could be, it's kind of the nature nurture kind of battle, where if it really goes into maybe resiliency is a better word for it too. Where if I'm able to be resilient in a situation, is there a genetic predisposition for that? Possibly. But also, what kind of environment was I, did I grow up in, or have I been around in my life? Was there a lot of resiliency? Was there a lot of, willpower, or people, pushing through things, in my life? Did I experience those kind of things? So it could be, there could be a genetic predisposition to it as well, but also could be, the environment that I'm in.
Can I expand on it just a little bit really quickly?
Sure, please.
Okay, so as a social worker, my training is, based in anti-racism. So we talk about generational trauma and how there's an epigenetic component to the generations of trauma that people have experienced, mostly BIPOC or, people of color. And it's not just, marginalized, impoverished people in real time. It's, generations and generations of that occurring. And the resiliency or the willpower is impacted based on, I don't know how tired you are or the lack of support because of your upbringing. I feel like it's all intertwined.
Sure.
So to be culturally competent, I think it's something that we need to also acknowledge.
No, I think it's a great point. Something I didn't think about when I was putting all that together. So I appreciate you sharing. Anything else? All right, we'll move on. So moral failing. So, I saw this picture and it was a real, kind of a good depiction of moral failure and the impact of that. Because not only are we talking that, people are failing, but they're failing with their morals. And so if we say that, that part of stigma is that we're saying that people have a moral failing. When you look at moral, it means relating to beliefs about what is right or wrong. And failure is a lack of success in doing or achieving something, especially in relation to a particular activity. So when you look at moral failure, really what you're saying is it's a lack of success about being able to either differentiate between what is right or wrong or being able to do what is right. It's basically saying they don't have any values, they don't have any beliefs, they don't have any morals. And that's not true. People do have, folks that struggle with substances, just because they struggle with substances doesn't mean that they don't have any values or morals or beliefs. Maybe they're not able to follow those right now for whatever reason. But that's a pretty impactful statement to kind of look at somebody and say they're a moral failure. Because, what does that mean to that person? What is that saying to that person? That they're just not able to, they don't have the ability to or they don't want that. Even more I think is impactful. They don't want or they don't care about morals or beliefs and values or what have you. So that's a pretty impactful statement when we look at that and stigma and the impact that stigma has on people and how, looking at them is that they're just a moral failure. So in any training, I think the most important thing is how can we help? We need to look at solutions and be focused on solutions. And so one of the things that we need to do is talk about non-stigmatizing language. And looking at, changing the way we communicate, that we treat people, that we just words that we use. Words are very powerful. And so, we're looking at non-stigmatizing language. I look at some of the terms that we use that we we need to kind of start thinking about and start changing. So one of them is substance abuse. And this was a term for years and years and years and years. This is what we called our area of, expertise was substance abuse. What do you do? Well, I'm a substance abuse therapist. I work in substance abuse. And a while ago, it was determined that, abuse is not the best word, okay, or at least not the most positive of terms. Because when you think of abuse, you think of physical abuse, sexual abuse, emotional abuse, what have you. And that kind of abuse and the abuse, so to speak, that when people use substances are not the same at all. So we went from substance abuse to substance use disorder. But even substance use disorder is not the most positive of terms either. And so, sometimes now we're going to more of a substance misuse. So it's just looking at some of the ways that we phrase things and some of the words that we use. Substance abuser, same kind of thing as abuse. If you're an abuser, that's a pretty powerful statement and not the most positive of ways. So maybe we just call them a patient or an individual. That's, someone who struggles with substances or what have you. Addict. This is a pretty powerful term as well. And I know when I work with people, struggling with substances, that's a hard thing for people to admit or say that they are. I'm an addict. I'm addicted to drugs or alcohol. And so, a lot of times what I've done is look at them and say, okay, we worked on it. So can we at least admit that drugs and alcohol cause problems in your life? And that's a little more gentle way to do it than just say you're an addict. Because what does an addict mean? Addict is a negative term. Addict, if I call somebody an addict, I'm not saying a lot of positive things about them. So maybe we want to talk about a person with diagnosed with substance use disorder. Again, because that might be a diagnosis doesn't really mean anything about the person, but it's a little more general. Or maybe we just refer to him as a person. User. Again, user, if somebody's a user, not the best term. Person who uses substances might be a little more gentle. Dirty urine screen. How many of us have said, oh, we all do urine drug screens. If you work in substance use, you're doing some urine drug screens, and their urine drug screen came back dirty. Okay. Well, what does dirty mean? Well, dirty means, I don't know, nasty, gross. It's certainly not a positive connotation. And so, something to be aware of as you're talking even about that, because yes, their drug substances were found in their system or whatever, in their urine, but that doesn't make them dirty, So maybe we say that they tested positive. Clean. I got 30 days clean. He's got 30 days clean. Well, it's the same kind of thing. Clean versus dirty. So, if I'm using, then I'm dirty. And if I'm not using, then I'm clean. So again, that one might seem, well, I don't think, that doesn't seem very harmful. Yeah. But again, when you look at the opposite side of it, they're using substances and they're dirty. So maybe they're, being in remission or recovery. Oops. So what are some other ones? What are some other terms that we might be able to get away from, or terms that are stigmatizing that maybe we can change? And what might we change those to? Anybody think of any other examples?
Drug addict versus substance misuser, something like that.
Uh-huh. Yep.
A
What else?
person, a person with
I'm sorry?
substance, a person with substance use disorder.
Right. That would be a more gentle or positive term, positive phrase, exactly. What might be some stigmatizing language that we use that we can maybe change?
In the chat, someone put addictive personality.
I like that. Very good. Very good.
Another one was medically assisted recovery.
Versus medically assisted treatment, I assume that they're saying. Yep. Any others? So these are just some other ones that I thought of. Junkie, you hear that term a lot. Somebody mentioned it earlier. We were talking about, words associated with stigma. Drunk, you call somebody who, drinks a lot, they're a drunk or whatever. Former reformed addict. Habit's an interesting one because, when you first look at that, at least when I first looked at that, was, well, it's not bad, but, what is a habit? It's kind of, when I crack my knuckles, that's a habit, I don't think it really goes into the seriousness of that as well. Person that uses substances. The other thing is person first language. And person first language focuses on the person and not on their illness. So, it looks at, they're not, they're not a substance abuser or whatever. It separates the person from their illness, separates the person from their disorder. And this isn't just for substances. This can be for a lot of different things, mental health. How many times we looked at we're working with somebody or we're, in a meeting with other people and they say, yeah, he's a schizophrenic. Well, no, he's a person who's diagnosed with schizophrenia. So it's the same, same along those lines, separating the person. The person is not their disorder. It allows us to communicate appropriately and respectfully with and about an individual. And it's intended to emphasize the fullness of a person and to avoid defining them exclusively by their disability or condition. So they are not their disability. They are not their disorder. They are not their diagnosis. They are a person who struggles with this. Somebody who is diagnosed with cancer, we wouldn't have that same negative connotation towards that person. We would, I don't even know what we would call them, but, you would say they're diagnosed with cancer. She's diagnosed with cancer. She's not cancer. He's diagnosed with cancer, what have you. And the last thing we can really do is really do what we're doing today and talk about stigma and talk about learn more and educate ourselves and educate the community on substance use disorders. We can look at how the difficulty and the shame and how difficult and reasons why people do not make changes or they struggle with making the changes that they need to make. Why they continue to use substances, even though they've experienced a negative consequence. It's hurting themselves, it's hurting other people. It's not that they're lazy, they're weak, they don't care, they're selfish. It's all the things we talked about, that, the impact on the brain and the physical withdrawals that they're going through and the emotional and mental health, issues that go along with it. A variety of other reasons that we discussed today. So educating ourselves about that, educating ourselves that, it is a brain disorder, it is a disease, and that, that they're not people to be shamed, they're not people to be discarded or anything, that they need help, they need to be valued, and the more we can value them, the more we be a part of that process and see them as people, the easier or the better it's going to be, the more likely that they're gonna be successful. Whenever anybody asks me, why'd you go into substance use treatment, why have you been in substance use treatment for 30 years? One of the biggest things I always say is that with this population, I've always found that there's hope. There's hope for everybody that I've ever worked with in regards to substance use disorder. There's hope for everybody that you work with, but this population, there's just always a hope for them, that they all have potential. They all have all these strengths, and they're incredible people and incredible things that they could accomplish. And I've seen people who have worked through and done the work and made the changes, and are leading incredibly successful lives and doing really well. So I've always found that there's hope with this population. There's hope for all the people that we work with. And that really is what, I enjoy about this field and I enjoy about this work. And so really we want to go from, all these words, drug addiction, and all the words that are associated with it, dirty, crime, despair, junkie, solitude, loneliness, all those, negative connotation, negative words that go along with drug addiction. We want to get away from that. And our goal is really kind of to get more towards, this kind, these kind of the phrases and words: respect, supportive, inclusive, listen, more positive, and really, really working towards viewing these folks as valuable people that, have all potential in the world to be successful. So that's all I have. We'll have a little bit of time for questions or comments or discussions or anything else that you all want that people need.
Quickly, in the chat, there was a quick, short couple conversation back and forth about letting clients or individuals who sometimes want to identify themselves as either a junkie or former junkie or alcoholic, because for them, it gives them their own accountability. It's their own narrative. So there's a discussion about like letting them make, if that's their choice, that's their choice.
Sure.
Because it's sometimes that's the way they frame it, and they need to frame it for their own responsibility.
I think it's a great point, because how they want to, view themselves or whatever, whatever they feel works for them, works for them. So, far be it for me to tell somebody that, well, the way that they tell their story, the way that they view themselves, the way they, if that works for them, more power to them by all means.
And there was another question that is how to help a person struggling with stigma with medical professionals.
So I think we've done a lot of good work over the years on that. And I think it's just continuing to educate folks. We have a lot more, I think, medical professionals working with, us in the substance use disorder field than we ever had before. Not only with, medication-resistant recovery or treatment or, in all that aspect, but just having folks, in offices, in their offices, working with treatment centers and understanding that it's not just the medication isn't gonna fix the problem, that medication plus therapy, medication plus treatment is really going to be the answer. So I think it's just continuing to educate folks and educate the medical professions. And I think a lot of people have gained a lot of knowledge over the years. There's still more work to do, but that's okay. We just keep plugging away.
And if I could just quickly add, I did a presentation with medical students, and they talked about how for them, it's the stigma within the medical professionals on the of trying to educate each other or almost feeling like being the non-popular crowd by prescribing or things of that nature. So us remembering that they're facing their own stigmas within their own culture and population as well. Tyler, I see that your hand is up.
Oh yeah, I think Britton's, excuse me, just put in the chat what I was actually thinking. On like an interpersonal level, when you're working with your clients, you want to advocate or encourage them to advocate for themselves with their medical provider. You know, people who have white coat syndrome, they don't want to go back to their PCP because they've been stigmatized so much. They just walked out of the office. You know, I work at a methadone clinic, so a lot of my clientele feels stigmatized because they're on methadone or they're seen as drug seeking or they have a history of, you know, stealing prescription pads, quote unquote. And I feel silly sometimes saying, well, just speak your truth or stand up for yourself. But in reality, it's sometimes not really safe to do that. And I know back in the day, we could go with certain people, you know, to doctor's appointments or encourage family members to do it, to go with, you know, the client to a provider appointment. But, you know, not everybody has that level of support. Not everybody is in assisted living. So it's a tricky intervention. You know, we don't have a lot of um, fundamentals to use to help them advocate for themselves, especially if it's unsafe.
Right. That's a good point.
Jenna as well. Jenna, if you're speaking, we can't hear you.
How about now?
Yes, now we can. There you go.
Okay. Sorry, it was through my headphones. It wasn't working. I just wanted to add to the thought that relapse plays in the stigma as well, because when somebody relapses, there's all of these negative feelings now that are coming because the stigma of I failed, they couldn't do it, they made another mistake, etc.
Yep, that's a great point. And not only stigma, within themselves, but stigma with people, outside themselves as well. And that they see, like they went, they stopped using, they started doing, healthy things for themselves, and then they went back out and they used, they relapse, and a lack of faith that they can do it again, or that they're doing it for the right reasons, that they really want to change, or are they just doing it to appease somebody or stay out of trouble with somebody, or the law, or their work, or what have you. So.
And then someone also acknowledged that the question regarding stigma with medical professionals was a good question, because they said even in pain clinics for someone who's diagnosed with cancer, that's experienced. And then sorry. And then someone else noted that they've experienced individuals feeling ashamed communicating with their medical professionals. And then the last comment is, your training hits home for me, as I've worked in the SUD field my entire time as a social worker and love this population. Love helping with empowerment with them and hearing their success stories.
Great. It's that's what keeps us all going, I think, is seeing the change that some people make, and the potential for more change, and even when people slip, if they get right back up and start moving forward again, then that's all the better.
I feel like the willpower, when you had those memes with the lack of willpower, that was powerful to me, because it's all over, right? Talk about that being everywhere in social
Right.
media, and this healthy, just have willpower. I think it's just actually mean, and take out addiction of that. I mean, in general, so many different facets in people's lives, to just say, that you lack willpower, or
Right.
look up to the mountains and you'll have willpower. I mean, I just feel like it's just absolutely, that's shameful.
Yeah.
And thank you for today.
Sure. Thank you.
What Leanne just said reminds me of provider bias, which also stigmatizes, you know, the treatment environment when you're the provider not checking your own biases and creating, this stigmatized intervention. That sucks.
Right.
Sucks for me, sucks for them, all around.
Anything else? All right. Well, I really appreciate everybody's time today and enjoyed speaking with everybody, and hope to do it again.
Thank you.
Thank you again, Scott. We appreciate it, and great topic again today. It was very informative. I will now place the evaluation for you guys in the chat here. Please make sure if you would like CEUs that that you do complete this. Let me just get it right there for you. Lots of thank yous coming in and awesome trainings. When you fill out the evaluation form, please make sure you use the email address that you would like the certificate to be emailed to. You will see an extra question that we put on there for this time, as we are meeting in a few weeks to work on next year's calendar. So if there's any topics that you would want to see that you didn't see this year, please, please, please put it in your feedback, for we do take that into consideration as we are making the schedule for next year. With that being said, next month, September, we do not have a workshop, but what we do have is our OCHN 16th Annual Recovery Celebration. I'm going to put the link also in the chat for you guys to register if you have not done so. We are super excited for this event. It is a Friday this year, and we will be having a recovery hip hop or person in recovery who's a hip hop artist, Kolichi, flying in. He has some great music on. He has huge following on YouTube and Facebook and things of that nature. Really powerful message if you've listened to his music. So he'll be doing speaking and a concert along with other fun activities. So hope you all can be there, and it is free. We only encourage registration so we can make sure we have enough food for everybody who attends. And then the next workshop will be in October. Hold on, I'm going to pull that one up really quick for you guys too, so I can put that link in. Scrolling really fast. Where are you? Which will be the last one of the first one next fiscal year, but last one of this current calendar. It is Recovery Recipe, a visual wellness tool toward relapse prevention planning with co-occurring population. It'll be presented by Jennifer Tackett, who is a certified alcohol addiction counselor and art therapist. I will get that link for you as well, so you guys can sign up for that if you haven't done so. 1 second, buddy. Just 1 second, please. Mommy's almost done. It's bedtime, guys. Sorry. So I'll put that in the chat for you too. And we are excited to have you guys attend either of those events. And so take the time now I'll put the evaluation one more time in the chat if you haven't done so. The evaluation is open until noon tomorrow, just in case you are not by your computer. We made sure to extend that for the morning hours to give you a chance to do that. The certificate does take 10 to 14 business days, guys. So make sure it's business days you're keeping track of. Our training teams are the ones who do the certificates. And I know they've had a few trainings recently, so it just gives them time to go through the attendance list and the evaluation list and make sure that they're using their correct email. If it's been the 14 business days and you have not got it, please feel free to reach out to me. That usually means there's a typo with emails and we can quickly get it to you. So with that being said, thank you all again for being here. I will stay on just to make sure everyone can complete the evaluation, or if there's any questions about anything else, I am here. If not, I always sign off at 8 o'clock. So we appreciate you all, and thank you again for coming.
Thanks again, everybody. Take care.
Okay, was that the recording?